This podcast is supported by advertising outside the UK.
Hello, I'm Dr. Michael Mosley and welcome to my new BBC Radio 4 podcast series, Stay Young. In each episode, I'll explore one simple, scientifically proven thing you can do to rejuvenate yourself from the inside out. Which will you try? Maybe a slice of mango to reduce your wrinkles.
Delicious.
Or learning something new to stay sharp.
Hi, okay.
How about lifting some weights to protect your muscles against the ravages of time?
That was quite tough.
To hear all about how to stay young, subscribe to the series wherever you get your podcasts.
Hello there and welcome to the Inside Health podcast with me, James Gallagher. Close your eyes, take a deep breath, because we're about to do some yoga.
So the first thing is breathe in and a breath out. Take your hands onto the edge of a table. So it's a very unusual way to use the table. And then just gently take your elbows forwards and put your elbows onto the table. Go right forwards, that's it. And then rest your forehead on your arms.
I am very comfortable. Can I just go to sleep? I'll be honest, I think I look like I've just got home from a really bad day at work and just collapsed on the table.
It is a good pose for stress. Walk back with your hands, walk forwards with your feet. Use your hands, breath out to move, and then just stand upright. So what we should have is an afterglow.
Well, I hope you're glowing too. I'm in a yoga studio near Stockbridge in the depths of the Hampshire countryside because it's time for our Inside Health special on back pain and particularly lower back pain. We've been promising it for weeks. You've been sending in your questions. I've got dozens of questions after doing my back in. So let's answer as many as we can with our crew of back pain supremos.
My name's Richard Husselby and I'm a physiotherapist working in a large community trust in the Midlands.
I'm Emma Godfrey and I'm a health psychologist working at King's College London.
And I'm Alison Trewheeler from Cornwall, and I'm a yoga teacher, yoga therapist, and then I became a yoga researcher, so we have this yoga evidence-based programme.
My name is David Elliott. I'm a chiropractor working with a multidisciplinary clinic in Essex.
Well, it's a motley crew in this yoga studio in Stockbridge. And I'll be honest, I feel like I've walked into a joke. It's kind of like what happens when you put a physiotherapist, a psychologist, a chiropractor and a yoga instructor. Kind of like what happens if they all walk into a bar. I don't know what the punchline to this joke is, but I'm sure if anyone wants to write in with it, then I'd love to hear it. Back pain's obviously a big thing. Lots of people getting in touch, including listener Richard.
My name is Richard and I live in North Devon. I've had low back pain for 50 years, having injured my back while playing football. I had unsuccessful back surgery in 1992 and have had chiropractic treatment for many years, but I'm still hopeful of finding a long-lasting solution.
Richard, can I start with you just to tackle that? I mean, like, how common are back problems in general, and then something lasting 50 years a bit? I mean, like, is that an extreme case or is that something you would see?
So back problems are common. 60% of the population will experience back pain within their lifetime. And I think 50% of the population will experience some form of back pain within the previous year. So we see a lot of back pain in musculoskeletal services. 35% of our 35,000 referrals a year are low back pain.
Crikey.
And many will be in the age group 40 through 60 and will describe decades worth of back pain. So that does sound familiar to me.
Emma, it must take a toll on people.
Yeah, it really does. And unfortunately, people do have anxiety and depression and stress as a result of having back pain. But also, unfortunately, if you have a common mental health problem like that, you're more likely also to experience chronic pain.
If somebody's had back pain for 50 years, I mean, like, if you start having back problems, Richard, are you doomed to having it forever?
Yeah, I mean, absolutely not. After 50 years, there's going to be lots of things wrapped up in that. But that can be unpicked.
Well, hopefully by the end of today, we'll have an idea of what does work and what helps and where people need to go.
Absolutely.
But Richard, I'm interested in the anatomy of back pain. What is it? What's going on that causes back pain?
Back pain is multifactorial. It's always a combination of your thoughts, your feelings, societal factors, and the structures at play. What we're good at is picking up the serious and the sinister. We can exclude those and rule those out well. But then the 95% of people that are coming in with a variety of pain experienced in their back, we can't be so specific. And efforts to do so generally take us down rabbit holes.
What is it about our backs that make it so vulnerable?
Nature and evolution rarely gets things wrong. So to talk about the back as being a vulnerable structure is probably more vulnerable in the current age that we're living in. The back is a rich structure. It's got lots of things going on. So if we're not using and engaging these evolved postural muscles, these anti-gravity muscles that hold our joints up and animate us, if most of the day we're sitting about in cars or in offices, these structures are compressing, they're loading, they're fatiguing, and they're causing pain.
So when I had my back pain problems, one of the things that I was recommended to do was to sign up to either a yoga or a Pilates course. And Alison, perfect person to speak to. Was that sound advice?
I think there is a bit of a problem that yoga has grown exponentially throughout the UK, and there are so many yoga teachers and so many kinds of yoga that that's not necessarily the most helpful advice that anyone could be given. So University of York in 2011 had published papers saying yoga works for back pain, and that's great, but actually it's then, well, where do you go? So we do have a specific program, ours is, but if somebody went to a class and they were doing jumping around things, or they were sat meditating in cross-legged position for hours at a time in a cold room, they could end up with worse back pain, or they could be asked to do lots of strenuous poses that are overly stretchy. So that could be an issue, yes.
So don't do any old yoga class is the point. How do you find the right one then? Because I can go onto the internet and just search yoga for back pain, and I will have my choice of videos and online programs to follow. Are they sound or are they a mixed bag?
Definitely a mixed bag. There will be some people who have that as a career and they are professionals and they can put their YouTube videos up soundly knowing that they will be insured. But from the yoga point of view, even me with the strongest, most robust, rigorous piece of yoga research, not just in the UK, but perhaps internationally, I have been advised that it wouldn't be a good thing for me to put YouTube videos out there. So that then makes you think, well, who is doing that? So be wary of that and find a good teacher to start with.
Richard, physiotherapy, for the more serious cases, you're going to be one of the first people the NHS turns to. So what works once you have somebody who already has back pain?
Exercise can work. Manual therapy, massage therapy, manipulation can work. Talking therapy can work. What we think is it's possibly more to do with the person in front of you than it often is to do with the condition they have. What does good look like to that individual if they've had successful manipulation, whether that's soft tissue or joint in the past? There's an expectation that that is required, and if you deviate too much from that, then you're not meeting that expectation and you're likely to have a poor outcome.
Can I just, while we're here, David, Richard, just spare any confusion for me, because many people will see a physiotherapist for back pain. Many people will choose to pay to see a chiropractor for back pain. What's the difference?
Hopefully, not very much. Traditionally, there have been some differences in treatment approaches. But as research continues and education gets better and better, the Venn diagram of what we both do crosses closer and closer. Long term, the hope is that that mimics each other. There shouldn't be a disparity in treatment styles or expected outcomes, whether you're seeing a physio, a chiropractor, an osteopath even.
Richard, if I was having therapy from you and David, would we just be able to play Snap or...
Hopefully. I think David articulated well there. The sort of dovetailing of these professions as the years have gone on. And I've witnessed that personally in the last 20 years since being in physio.
Well, let's hear from Rolf, who's one of the many people that got in touch asking questions about chiropractic therapy.
Hi, my name is Rolf. In my early 30s, I developed, for no apparent reason, severe lower back pain. I was recommended a chiropractor in Leeds who x-rayed me, said that although he couldn't help everyone, he could help me, and so it turned out. I should that I once visited a self-taught, somewhat elderly chiropractor who really made things very, very much worse. How can one be sure that the chiropractor is properly trained, and why are backs apparently so poorly understood?
Serious and interesting question there from Rolf about how do you know that you're seeing the right person and the right chiropractor? Because it's a very big and broad discipline, isn't it? It's one that the NHS has an interesting dynamic with, one where it largely sees it as a alternative or complementary medicine, but at the same time there are some guidelines where it can be appropriate, particularly around back pain. So guide us through it, David.
So the evidence for spinal manipulation is quite strong. This is not limited to chiropractors. However, physiotherapists and osteopaths do very similar techniques. Chiropractic itself is not just the manipulation of the spine, but also soft tissue techniques, so massage and the application and usage of exercise therapy, of rehabilitative movements. To find a chiropractor that works for you and is adequately qualified, I would suggest searching the British Chiropractic Association, the BCA website. As a short note, I would advise that you check that they are properly qualified, definitely not self-taught. It's not a thing that one can self-learn, much like physiotherapy or osteopathy.
I just want to deal with now, though, a question from Fran.
My name is Fran and I'm from Keswick, which is in the Lake District. I've had back pain since I was about 15 due to a combination of osteoarthritis, facet joint degeneration and slipped discs. It took until I was 27 for a diagnosis to be made and to receive treatment. My question is, why does it take so long to get a diagnosis and treatment?
Who wants to take that one on? Richard?
It's amazing, isn't it, the value for that individual of getting a diagnosis. We want a diagnosis. It shines a light in the dark. And the treatment, invariably, for her problem will have looked much like the treatment had she not received a diagnosis. I'd guess exercise and eventually getting better. But that drive to get clinical certainty has probably fueled some of her problem, has fed into the anxiety of not having the diagnosis, and shows us what challenges we're really facing when we're dealing with people and people's expectations and unresolved problems.
Emma?
Yeah, I was going to say people's expectations and people's beliefs are so important.
But some people are in serious pain.
Yes, and some people, because the pain is so intense, might need to go to a physio and get some exercises or some other things that can help. And I think one of the issues with back pain is that you can have a scan and you can see something on the scan, but that might have no relation whatsoever to how much pain you have. Because there are people who have things on scans but no pain, and people who have pain and nothing will show up on a scan.
While we're thinking about treatments, we have a question from Sarah.
Hello, this is Sarah from Oxford. My dad was urgently referred to A&E with back pain and fitted with a brace. My questions are, what evidence is there that braces are effective for protecting the spinal cord and reducing or preventing back pain? And would simple advice on moving be just as useful? Thank you.
David?
The research into how a brace may help to physically stabilise the spine is pretty poor, to be quite frank. What it will mostly do is provide an awareness around the trunk, an idea, a proprioceptive feedback of how he is standing, sitting, hopefully preventing him getting into a posture or position that may re-aggravate the back. Unfortunately, it really depends on what he presented to A&E with. If there was a fracture, I doubt he'd be walking out the door with a simple brace. However, long term, if we continue to wear such braces or supports, it's actually been shown to prolong or worsen pain. What we end up doing is not working or moving said painful area, and that will actually worsen over time. Perhaps better may have been some advice over reducing some movement over a short period of time to avoid aggravation, then engaging and gradually building some resilience back through the spine.
We've had quite a lot of other suggestions of things that people think have worked for them.
Hello, my name's Wendy. I'm a 68-year-old retired social worker. I've had backaches since my early 20s. I find the best form of treatment is regular Iyengar yoga and Pilates lessons, together with work at home, including morning exercises, swimming and walking on a daily basis. I wonder if there is any evidence for the work that I do that helps backache. Thanks.
Easy one for you. Yoga and Pilates, Alison.
Yoga for healthy lower backs has a lot of strong evidence, and when we went to NICE guidelines in 2016, we were a stakeholder in there. The yoga evidence showed for itself it would be cost effective and effective for back pain. A little bit of research for Pilates as well.
David, what about swimming?
Absolutely. Good non-weight-bearing activity. Most importantly, it's an activity. It's something to do. If you're comfortable swimming, do swimming. If swimming hurts your back, don't do swimming.
I think the point is that
we're
all trying to get people engaged in life again, doing the things that they want to do. And there are lots of different routes to that, but the end goal is very similar.
And I think believing that they can.
Well, Alison, shall we get an idea of what good yoga for back pain looks like? Shall we have a little breakout session?
I think we better. Draw the kneecaps up. Draw the whole of your legs, suctioning them up into your hips. Mm-hmm. Put wing nuts on your hips, so tap your hips. So you're doing them up. Tailbone in and up. Tummy in and up. Breastbone forwards and up. Take your arms down, stretch them. Smile as well.
I'm concentrating on too many things.
And breathe. And then relax. This would be perhaps going a little bit further. So we're putting our hands here, and then you're going to just step back. Yeah, so you're going to step back. Take your feet back underneath your hips. Stretch through your fingers, stretch through your arms, stretch through your armpits. Take the outer hips into the middle of the room. And then let your head go out like a tortoise into the middle.
Sorry, I'm a bad pupil.
That's okay. And then gently walk forwards with your feet. This particular yoga for healthy lower backs was 30% better than usual care. It also showed that people had 70% less time off work in the year that we analysed them. 9 months later, people were still practising yoga twice a week, and improvements were maintained 12 months after starting the 3-month yoga course.
Well, as tempting as it is to keep going with the yoga poses, we probably should get back to answering your questions about back pain with psychologist Emma Godfrey, chiropractor David Elliott, physiotherapist Richard Hosselby, and of course, yoga instructor Alison Trey-Wheeler. Now, listener Stuart emailed insidehealth@bbc.co.uk with his back pain remedy, and I'll be honest, sounds like a lot of fun.
Hi, my name's Stuart from Weymouth. I've had on and off lower back pain for most of my life, having tried various remedies like hot mud packs, prescription pain medication and sleeping on the floor. I found a couple of frames of snooker is the best remedy.
Emma, what do you think?
I think that's absolutely great. Whatever works for you is what you should do. And I think as long as it's something you enjoy, you're going to keep doing it, which is really, really important. And it will get you active, it will get you engaged, it will get you socially connected with other people. And that's really what we want.
Richard, it's a really interesting turnaround, isn't it? Because if you were to go back, not actually that long ago, bed rest was often a recommendation for back pain. That's completely U-turned.
Yes, that's right. We're moving more towards activity. So in the past, as caring souls, in the treatment of pain, we'd want to do something that avoided that person experiencing pain, and rest felt like a good idea. And now the idea has changed. Pain is an output of the brain. It's a combination of a potential injury, our hopes, our fears, our anxieties, our worries, and the social context it's in. So it's a challenge. But that example with snooker is great. For that chap, it got him moving better. He was bending across the table. You know, we could talk about that on a structural level. He was moving his nerves, moving his muscles, moving his joints, and it worked for him. For another person with potentially a really sort of nasty acute sciatica, that wouldn't have worked. So we can't just say, everybody do snooker. Snooker's better than yoga or whatever. It's what's of best value to that individual. If it's not that painful, do it. If it's a bit painful, have a little bit of a go at it. But that's great that it worked for him.
But I think what's really coming out of this is that you have to have time. And that's where talking therapies come in. And I think that's one of the issues that we have in the NHS quite often, that there isn't enough time to do it.
Emma, I'm really glad you're here because I do want to chat about the connection between back pain and our minds and the brain.
Hi there, I'm Charlie and I'm from London. When I was 21, I was debilitated by back and hip pain for about 3 years. After learning about the mind-body connection and our nervous system, I was able to heal from my pain using those techniques. Can you explain why our mind impacts our physical health so much?
Yeah, well, obviously our beliefs, our expectations and our emotions affect everything in our body. For example, with your beliefs, if you start to be afraid of moving and think that moving is going to cause damage, then you're not going to move, and then you're not going to get any better. You're going to get deconditioned. And in fact, you may get worse. When we're working with people who've got chronic pain, what we're trying to do is to really explore that with them and move away from this struggling with the pain and trying to get rid of the pain and move towards sort of trying to live life in a way that's fulfilling for that person.
And do we know that that works as an approach in back pain?
We do know that it works alongside, I think, physiotherapy is the best bet. And actually, Richard and I have done some interesting work on that. We did a trial at King's called the PACT trial, which was published in 2020 in the Journal of Pain. And what we found was this combined psychologically informed physiotherapy actually helped people to function better in the short term. And that was really, really important. And this was a very small intervention, only 3 sessions, because we wanted to do something that was similar to what people would get in the NHS. We realise that how you talk to people and how you make that rapport and that relationship with the patient is so, so important if you want to get any kind of good results and really help that person.
Instead of just pushing and prodding and manipulating X, Y, and Z, we're now setting some realistic goals about getting back to functional activity that might be walking the kids to school. We shift the focus back to the function. And hopefully over a course of several sessions, we've moved people back to meaningful living. Funnily enough, the pain takes care of itself.
Alison, does that mind-body thing chime for you as a yoga teacher?
Definitely. I often get people will come along to the 12-week courses and they'll start off saying, I'm in constant pain. And then when you actually question them and query and say, what do you mean constant? Is that in the morning, in the lunchtime, in the evening, when you're in sleep, when you're walking, when you're in the car? And they'll say, no, it's just here, it's just there. So then you get them to do a yoga pose and you say, what's the pain level, 0 to 10 before it? What's it like after? It's very empowering for them to realise they've turned the volume of the pain down. Maybe I might say, what's your pain at the beginning of a yoga session? What's it at the end? And again, they've gone from a 10, a lot of pain. I'm in constant pain. They think they are. They think they're on a 10. You make them notice they've gone down to a 1 or a none. And it's a goal. It's transformational because they realise they can affect their pain levels.
Emma, can you pay close attention to our next question from Jane? Actually, all of you pay close attention to our next question from Jane.
Hi, my name is Jane Coggle and I live in Herefordshire. I suffered with chronic back pain for a number of years, but a couple of years ago I was able to consciously switch off somewhat from worrying about things out of my control, particularly family members, and my pain did improve considerably.
I mean, I think that stress can exacerbate pain. On its own, it probably isn't a completely causal factor, but it's certainly in the mix there. If you're stressed, your breathing is going to change, but also if you start thinking about pain a lot, that's going to make you aware of the pain more and it's going to get worse. But I think what was interesting about what Jane said was thinking about things differently is really, really important. And I think that's the key to actually making a difference here. Popular painkillers like aspirin and ibuprofen, they don't actually generally relieve back pain, unfortunately. For example, a recent study found that only 1 in 6 patients who were treated with these non-steroidal anti-inflammatory pills like aspirin and ibuprofen had any significant reduction in pain, and that the people who were taking this medication were 2.5 times more likely to suffer from gastrointestinal problems like stomach ulcers and bleeding.
But that's at the very low end, Emma, isn't it? Kind of like the pain relief you get. There are much stronger painkillers out there that some people will have.
Yeah, there are opioids, and there's a huge risk with those of becoming addicted, and they are not recommended for the kind of non-specific low back pain that we've been talking about. If you're the bus driver of your life, you've got a passenger on your bus, which is your pain. You don't want to let that passenger take over the driving and tell you where to go, because you're still in charge of your bus and you've got to decide where you want to go with your life.
I've had a lovely time sat here with all of you thinking about back pain and the treatment of it. But I have this nagging question at the back of my mind about whether almost actually the whole approach here is wrong. And we need to be thinking a lot more about preventing people having back pain in the first place rather than treating people afterwards. You were saying at the beginning, Physio Richard, that it's like 60% of people and modern lifestyles are a major contributing factor. So are we just dealing with it way too late?
Yes, we are. And there's some really exciting programs underway right now, which is the good news story. But really, we're talking about societal level change, and that's massive. We've talked about the challenges of just changing some people here and people's beliefs, let alone the therapists. But if we're talking about societal level, that's a whole nother conversation. But absolutely, change has to come earlier if we're going to address this.
Julie emailed insidehealth@bbc.co.uk, and she had back strain a few years ago, and she's really concerned about how does she ensure it doesn't happen again. So David, what are the kind of things, if we're thinking about preventing back pain, that can be done?
So for Julie, of course, it depends on how that original irritation occurred. Unfortunately, we can't promise to prevent or completely guard against any future back pain, but the tenets are regular movement, some sort of strength work and some mobility work. So whether it's Pilates, yoga, or just getting out into nature, walking, something that will provide some resilience for her back and some enjoyment, hopefully. Crikey, imagine that. Some enjoyment out of her therapy. That's what I'd suggest.
Does a lot of this come down to like the idea, the concept that people have of strengthening the core? If I have a stronger core, then I'm not going to have back pain. Richard?
We did a piece of work and it was titled The Myth of Core Stability, because we found that we were probably over-egging the custard with this one. And what we had the danger of doing is pulling all our eggs in one basket and saying, you know, it's all about the core. You've got to strengthen this core, and if you're going to do it, you've got to do it right. Tense this muscle first and squeeze that muscle after. And, you know, you'd be watching these rigid movements in clinic being reenacted out with, I think I've got it right. Is this perfect? And we realised we're creating a monster where we're becoming part of the problem. So yes, there's a myth there, but is a good functioning set of core muscles good for your body? Absolutely. But it can be engaged with a whole host of stuff, of which yoga is one, I'm sure. Pilates is another. Swimming is another. Weightlifting is another, etc., etc.
Is there anything on the horizon that is going to transform back pain? Like, is there anything kind of like exciting that people are thinking, right, this is the thing that we can kind of like eliminate back pain as a problem? Or is it always going to be something that we're going to have to live with and work through?
Depends if we stay sedentary or whether we all get moving a bit more. We need to learn how to be relaxed and deal with stress. I think that's a huge issue in this day and age, that we're all too stressed.
I think chasing a pain-free life is like chasing an ever-distant horizon. The more you want it, the further away it's going to get. And I would agree there with Alison, and I think all of our sentiments today. We just need to be out there, getting more active, sitting less sedentary.
Yeah, and I think accepting a bit of pain if we have it, and not catastrophizing about it and seeing it as something really serious or worrying.
More programs like this, hopefully more mediums of getting this message out to people, creating an overall empowerment with people with back pain. Once they have that knowledge, they can go out and hopefully feel better.
I think the main message is you can do something to help yourself.
Well, thank you all for coming. I remember right at the beginning, I said it felt like it was a joke, all of us coming into here, a chiropractor, a physiotherapist, a psychologist, and a yoga teacher. It feels like actually it's not a joke. We're all saying the same thing.
I think if you'd been 20 years ago, it would have been more of a bun fight, but it certainly seems that we're all singing from the same hymn sheet.
Well, thank you everyone for taking part in our special on back pain today. To Emma Godfrey, psychological researcher at King's College London, David Elliott, a chiropractor, Richard Hosselby, a physiotherapist working in the West Midlands, and Alison Freywheeler, a yoga instructor. Thank you so much for having us all in. I feel it would be appropriate for you to finish the session with something nice and calm and relaxing for us. Can you do that?
And this is the end of every class on the Yoga for Healthy Lower Backs programme. And it's something that we would recommend that people would do if they had a flare-up of back pain. Try to get down to the floor to do a 10-minute relaxation, but then keep moving after they've done that. So,
right then, everyone to the floor.
You're going to start to lie down on your back and then just gently bring your knees in towards your chest. Hold your knees with a breath out. Relax your feet and then your ankles. And think about your lower legs. Relax your ankles. Relax your knees. And then going to your thighs, the front thighs, the back thighs, outer thighs, inner thighs. Relaxing the hips.
Oh, that was relaxing, wasn't it? Thank you for listening to this Inside Health podcast special on back pain. With me, James Gallagher. The producer was Julia Ravey, and the studio manager was Giles Aspen.
Hello, I'm Dr. Michael Mosley, and welcome to my new BBC Radio 4 podcast series, Stay Young. In each episode, I'll explore one simple, scientifically proven thing you can do to rejuvenate yourself from the inside out. Which will you try? Maybe a slice of mango to reduce your wrinkles.
Delicious.
Or learning something new to stay sharp.
Hi, okay.
How about lifting some weights to protect your muscles against the ravages of time?
That was quite tough.
To hear all about how to stay young, subscribe to the series wherever you get your podcasts.